Well, first I'll talk about digital x-rays because that's something every new patient gets when they come in. So digital x-rays, the benefit of the digital x-rays over the conventional x-rays are way less radiation, number one. The other thing is the way that we can see instantly whether we got a good x-ray or not and retake it right away. We're not like taking x-rays to another room and developing them and bringing them back, and they're on the screen right away, so we can immediately start diagnosing and helping the patient understand their condition. And the other benefit is that we can manipulate these x-rays, make them big, change the contrast so we can see different things on them. The conventional x-rays, we couldn't do that because once in a while I get x-rays from another office when a patient has moved to the area and they're the old kind, and I'm like, I don't even know how I was able to do a good job with these in the past before we had digital x-rays, so they're a major advantage. We also have a CBCT scan, which is what most people call a CAT scan. And this allows us to see images in 3 dimensions. So we can see the bone if there's a case for implants, to see where the nerve is so we're not disturbing the nerve, or to see if there is enough bone or good quality bone. Also helps in diagnosing cracked teeth and certain abscesses and root canal problems. And we're one of the only offices in the area that has one at this time, so we find it very helpful. We used to have to refer out to specialists if we needed a scan, and we no longer have to do that. And sometimes the patients are confused. Why do we have to go there just to get the scan? And then the specialist starts putting in their opinion about different things or whatever, and it's confusing to the patient, so we're very fortunate to have that. We also have a couple different methods for detecting decay that doesn't show on x-rays, and one is the diagnodent, which gives us a hardness reading on the tooth, and we can detect a small cavity so we don't have to wait for it to be huge and need a root canal or make a big hole inside somebody's tooth. So it allows us to be very conservative. And another one is called the caries view, which uses fluorescent light to detect shadows and decay in the teeth. And it can't be used on all teeth, but on posterior teeth it can show quite a bit. And one advantage with that is, let's say you have somebody that can't have an x-ray, even though the digital x-rays don't have a lot of radiation, but our pregnant patients would prefer not to have an x-ray, as I was the same way when I was pregnant, and certain other patients that have had a lot of radiation treatment. So we have some other ways to be able to diagnose decay on these patients.